Good morning students. Today I will tell you how to write a lesson plan. For example, you got a topic on cirrhosis of liver. So you have to write the first page of lesson plan on cirrhosis of liver. You can write it here. Then submit it to whom, which teacher you are going to submit. Then your name and the class. That is the first or the front page. And second page again. The second page is this page consists of the lesson plan on. Again, we have to write lesson plan on cirrhosis of liver. Then the subject means in which subject this cirrhosis of liver comes. That is in the medical nursing or in the surgical nursing or in the advanced nursing. Which year you are studying, that's depend upon. So you can write. Means for example, if it is comes under the medical nursing, so subject you can write medical nursing. Then you have to see the syllabus of medical nursing and see which unit it comes. Unit 1, 2, 3, 4. And one more thing, when you write a unit, you always have to write in Roman letters. It's like this 1. Or for 2 you write like this. Then or 4 you write like this. Then for 10th unit you write like this. These are the Roman numerals. So for writing the unit you have to write like this. It means not like 2 or 3. It means the Arab means English numerals. It has to be written in the Roman numerals. Then topic is, of course, it is a cirrhosis of liver. Then the method of teaching. For it means if you have a demonstration topic, you can write method of teaching lecture come demonstration. For example, you are going to demonstrate a temperature take or a means TPR for the first year nursing or students or the mouthwash for the students. Then you can write lecture come demonstration. But if you are taking in the classroom, you can like method of teaching is lecture come discussion. Why we are not writing only lecture means it's not only you are lecturing. When the students have some doubts, they have to ask. It's a common discussion. So we can write here lecture come discussion. Then previous knowledge. The student had classes on. So what you have to write here is for cirrhosis of liver. The topic was cirrhosis of liver. So which year means what was your first exposure to cirrhosis of liver? You might have studied in the physiology, the applied anatomy. Applied anatomy means in the anatomy you might have applied anatomy of means liver. You might have studied about the physiology, the cirrhosis of liver. In physiology, the altered functions of liver. You might have studied about the cirrhosis of liver. So here you can write the students had classes on cirrhosis of liver as a part of their first year nursing curriculum, that is in physiology of nursing or in anatomy of nursing. We can write here anatomy in the first year BSc nursing or physiology in the first year BSc nursing. Then the teaching aid or the ABAids, it's known as teaching aids. Teaching aids, of course, there will be blackboard and chalk if you are taking in the classroom, or the transparency OHP. OHP or means they never write OHP because OHP is the overhead projector. The machine is the our OHP. We are not use OHP is not our ABAids, but we are writing on a transparency. So you can write transparency showing what all things, the etiology, what all things you write in the transparency you can write here. That means the etiology of nursing or etiology of cirrhosis of liver, or you can claim the pathophysiology of cirrhosis of liver, whatever may be. Then if you are preparing any booklet on the treatment of cirrhosis of liver, plan diagram for the causes or etiology of liver, you can write. So this also means first we have to write the subject, then we have to write the unit, in which unit it comes, then the topic is the same one, lesson plan on. Then method of teaching, lecture come discussion if you are in the classroom teaching, then lecture come demonstration if it is taken in the clinical lab, then previous knowledge where the students have studied about this means cirrhosis of liver in the first, or they have a, or if means for example a students they never had an exposure to a particular disease, but they have a basic knowledge of anatomy and physiology, you can write here. Then teaching aid like blackboard and chalk, transparency showing, then booklet if you are preparing any booklet, leaflet, flannel graph. It depends upon your topic and your interest. Next is central objective. Central objective, we have there's two type of objective. One is central objective, second one is specific objective. Central objective is the one which and the main aim of your class. On completion of the class, the students will be able to acquire adequate knowledge regarding cirrhosis of liver and apply this in the clinical practice. Not only means by you are gaining this knowledge, it's not only to write your exam, but it has to be able to apply in the your clinical scenario or the clinical presentation. So central objective is on completion of the class, the students will be able to gain adequate knowledge regarding cirrhosis of liver and able to apply this knowledge in the clinical practice. That is like that you can write. If it is a community related topic, you can write the students able to gain adequate knowledge and apply this in the community setting. For example, it's a personal experience, like means personal. For the personal knowledge, they can means if they can means you can write apply this knowledge in their personal or in their day-to-day life. Like that you can write the central objective. Next comes the specific objective. Specific objective is the division of the central objective. We divide, we get the knowledge. How we get the knowledge of the cirrhosis of liver? We have to learn about the definition. We have to see about the pathophysiology, the etiology, preventive factors, the medical management, surgical management, nursing management. All these we have to learn. Then only we'll get a knowledge on the our central objective will be fulfilled. For that, we have to have a specific objective. Specific objective means on completion of the class, the students will be able to. These are verbs. When you have a known as verbs which we use: explain, describe, list down, enumerate, define, classify, differentiate. If you have any doubt, you can go through the class on educational objective which I have taken and posted in the Google Classroom. The notes are still there. You can see the particular verbs. These are known as verbs are so explain. On the first may be the define the cirrhosis of liver, explain the pathophysiology of liver, list down the types of liver, enumerate the pathophysiological changes. So it means like all these are the verbs which used for the specific objective. And one more thing, only one action should be there in a one objective. One objective should contain only one objective. That means you cannot write define and explain the pathophysiology of cirrhosis of liver. Only first is to define the cirrhosis of liver. Second is to explain the pathophysiology of liver. So like that you have to write the specific objective. So once you write the specific objective, here comes the main portions. So you have to write means draw the columns like this. The first from specific objective, the content, the time, teachers activity, learners activity, aviates and evaluation. So specific objective. So specific objective, what you are going to write here in the same order how you write here. So here is the first objective is define cirrhosis. Then here is the first objective should be define cirrhosis. Here means so whatever you have written in the front page, that in that flowchart, in that manner only you have to write the specific objective over here. So the first you may have to give a brief introduction. For the introduction there is no need to write a specific order. You can introduce the cirrhosis of liver by means by noting the usual the statistics of the Kerala or India or world. You can quote an example. So only thing the introduction should be interesting. So you can quote some examples, you can quote some scenarios, you can means if you have any personal experience with that, you can quote that. Like that you will write the introduction first. Introduction, there is no objective. So time we can write for the introduction how much time you need: 2 minutes, 1 minute, 3 minutes, like that the time. So the teacher's activity, but we are going to do in the you introduce the topic. You can write here introduce the topic, and if you are in a classroom teaching, you can write here introduce the topic and write the topic on the and write the topic on the blackboard. Write the topic on, introduce the topic, and once you finish the introduction, you can write today I'm going to. So at the end, you can say today we will see about the cirrhosis of liver, and you can write the topic on the blackboard. So what is the learner? This learner is the students who are sitting in the classroom. You can write the what the learners are doing. So learners are doing, they're just listening. So listens. When you write the objective is introduction in the class, they may not write down the topic, so you can write lessons. ABAs, if you have any interesting ABAs for the introduction, you can write. And evaluation questions, we will come, I will tell the next topic. So the first specific objective is define the cirrhosis of liver. So you can write here define the, so means once you finish your introduction, next you can write define the define the cirrhosis of liver, you can write here. And the content, you can write, you have to write the definition, you have to write the definition, you have to write, and time, how much time you need to define the topic. Then teacher's activity, if you have any OHP or you have any means LCD, means a PowerPoint presentation. For example, if you have an OHP, you means what you are going to show the transparency, shows. Show the transparency and explain it. So introduce the So for the definition, you write the definition, you write here. So in the teacher's activities, you show the transparency. You are not just telling it, you are show the transparency and you explains. And keep one more thing is the teacher's activity and learner's activity should be in the present tense. Introduces, it's not introduce, introduces, shows, listens, writes down, they write down the notes. So this teacher's activity and learner's activity should be in the present tense. That is the main thing you have to keep in your mind. Writes down the notes, they listens and writes down the notes. And ABAs, if you are using, so here is the overhaul project, and the transparency is the ABA. And evaluation, what do you mean by evaluation? For example, if you are telling about the pathophysiology of the cirrhosis of liver and the definition of cirrhosis of liver, if you want to ask some question, it's not, evaluation should be in a question form, and this should be, and it should not be in means soon after you finish the definition of labor, means don't ask the students what is the definition of labor. It is just a recalling. That is not the evaluation. You can ask any related items. Means what will be the, means for example, if you tell the etiology of cirrhosis of liver, there can be alcoholic cirrhosis, non-alcoholic cirrhosis, and why. So means you can tell one of, means what is a major means causative factor for the cirrhosis of liver. That means what is the major. It should be in a question form. Major etiological factors in our area or in the India, means like that you can ask the students. It should be in the question form, and you have to keep in mind that when you take the class, you should ask the same question to the class. So because in the beginning you maybe get nervous, you may forget, you may, means when you ask in a hurry, the grammar may not be correct. For that that is why the lesson plan we are asking you to write it. So the evaluation should be in the question form, and question mark should be it should be in the question form. So a definition, pathophysiology, when all this means comes means when we come to an end of the content, like it depend the definition, etiology, pathophysiology, clinical features, management, everything we have to write. The content we have to write, the time, how much time you need, and the teacher's activity show the transparency and explain or reads or explains, then demonstrates what, or maybe and the students will be, they listens and writes down the notes, listens and write down the notes they have to write. And keep in mind this should be in the present tense and ABS, which abbreviates an evaluation question. And at the end you have to write the summary means summary of the topic. Means so far we have seen the etiology, clinical features, pathophysiology, and means don't just say that you have, so far we have seen the definition, etiology. Tell the definition of cirrhosis of liver, at least 2 or 3 causative factors, the main pathophysiological changes. In a 1 or 2 sentence you have to, means keep in mind your 1 or 2 sentence you may have to finish the summary, not in a elaborate way, but in means at least short 2 or 3 clinical features, the main medical management, the main surgical management, the name of the surgery, and the nursing management. So it's like that you have to write the summary. Then conclusion. Conclusion is a general. General means cirrhosis in relation with the health, also cirrhosis in relation with the medicine. It's a common fact. It's a common disorder which affect the liver because of the common etiology factor is the alcoholism. Like that, you can say the general conclusion. Then assignment. Once you finish the topic, you have to give one assignment to the students. It is not one which you have studied in the class. Means we have taught in the class. It is not about the nursing management because it is the teacher's responsibility to take the class in means medical management, surgical management, and nursing management. So nursing management never give it as a assignment because it is a responsibility of the teacher. Don't skip that way. So assignment you have to plan. You can write the means you can ask the students to draw a draw in the complications of cirrhosis of liver, or how will you manage esophageal diabetes or second tube. Like that you can ask them to, you have to think and means come out in a productive and a positive means enforcement, like and with a good assignment you can come out. Before the assignment, you have to ask recapitulation. You have to list down some questions. The teachers, the content you have to write some questions has to be written. What all questions you are going to ask the students in the content which you have taken. Time and teacher's activity. Teacher asks the questions. Students ask activities, answers the questions. Then after that you have means after recapitulations you give the assignment. Once the assignment given for that part, for means if you are given what means what is the sense taken to the medical management in elaboration. For example, if you are given a management sense taken tube and its management, for writing that particular assignment, which textbooks they have to refer, that is the student reference. I hope you understood what is student reference and teacher's reference. Student reference is whatever the assignment which you have given. For writing that particular assignment, which textbook the student should be referred, that is the student reference. The teacher's reference are the which all textbooks you refer to take this particular class. The class you have taken referring which all textbook. That is the difference between student reference and teacher's reference. Student reference is to write for writing this particular assignment you can refer the student in the textbook's name you can give, and for taking this particular class which all textbooks you refer, that is the teacher's reference. So that's all about the means writing a lesson plan. Lesson plans, you have a specific objective. Specific objective should be in the order how you write here. That means here it is the explain, describe, list down. So the same order should be followed here. Then content you have to write, and the content time should be tallied. You may have a 45 minutes or 30 minutes, how much ever time is given, that should be tallied. And teacher's activity and learner's activity should be the present tense, that is introduces, listens, writes down, shows, explains. like that it comes. And the aviates, which means which aviate you are using. If there is no means if you are not using any OHP or the micro means the PowerPoint presentation, it means blackboard and chalk you can write. So evaluation should be in a question form. It's not just a detailed duplication of what is your content. Here you have sent define the cirrhosis of liver, and you cannot ask a question like define cirrhosis of liver. It should be a related matter, but in a different way you can ask. So then the summary regarding the topic, in conclusion in general, and recapitulation is the questions which you are going to ask. And keep in mind the same questions you should ask the students, not in a different questions. The same questions you have to ask. Why I am telling you have to ask the same questions? Because for these questions you have an answer in your mind. The students are giving a wrong answer, you will be able to correct it. As a beginning teacher, if you ask a different question, sometimes you may not be able to correct the students properly. That's why I'm telling you have to ask the same question, then give an assignment to the students. And for writing the assignment, which text the students have to refer, you can write as a student reference, and which textbook you have referred to take this class, you can write as a teacher's reference. This is in short of writing a lesson plan. I hope you understood. If you have any doubts or any clarification, you can always call. So here is the sample copy of a lesson plan. So lesson plan on curriculum development. I have not submitted to anyone because it is to keep the subject file I wrote. So it is only prepared by. Submitted by and submitted to, it is not there. So don't write in that way. It is for my reference I have prepared. So that is why it is like prepared by. Then lesson plan on curriculum development. Subject is nursing education. Unit 2. Curriculum is curriculum development. One more thing. Sorry, I forgot. So here you have to write the name of the teacher. Name of the teacher is your name. The person who is going to write means take the class, not my name or the evaluator's name. Number of students. For example, in your class 50 students are there. The remaining 49 is number of your class students. Then group. Group means if you are taking in your class, it is a 4th year BSc nursing classroom. If you are taking it for the first year, it is a first year BSc nursing. Then day. The day which you are take. The time. Time is 2 to 3 or 3 to 4. As you means whatever time you have, it's given to you. And duration. Duration is how much, same thing, it's 1 hour, 30 minutes, 45 minutes, like venue. If you are taking in a first year classroom, it is a first year classroom. Second year, if it is in the second year classroom, it is second year classroom. If it is a demonstration which you have to take in the means fundamentalist labs, you can write the preclinical lab or the fundamental lab. It is the important thing. And name of teacher is not the teacher is going to evaluate, but the teacher who, because the teacher going to evaluate is not, it's the name of the teacher is the person who is going to take the class is the name of the teacher. And the remaining members, if you are taking for the same class, you have except you, others will be the students. So you can write is 49. So group 4th year. If you are taking the same class, it is 4th year. If it is taking for the 3rd year, it is 3rd year classroom. And date, time, duration, and pay. This is one more thing which comes in the second page. So first page is submitted by, then lesson plan on, and this is the main content. I hope you understood. If you have any doubt, you can ask me. Okay, thank you.